Hey guys, Dr. Childs here. Today we're going to be talking about adrenal reset complex, also known as A.R.C II. So the ARC stands for adrenal reset complex, if you didn't catch that already. And the number 2 is because this is a second formulation of an adrenal supplement I have, the first being thyroid adrenal reset complex, which is one of our best sellers. You can read about that or listen to another video I have on that. But today we're talking about A.R.C II. Okay, so what is A.R.C II? A.R.C II is an adrenal supplement, is a vegan adrenal supplement, and it provides the benefit of helping address your adrenals. And by virtue of doing that, it also is helping a little bit of your thyroid function. But its primary purpose is to address adrenal function. Now, what does that mean? It means it's going to help balance cortisol levels. It's going to provide you with more energy. It's going to help you reduce your stress. It will potentially help improve your metabolism, especially if it's sluggish and being brought down by your cortisol. It may help balance your other hormones in your body as well, such as sex hormones. And then, of course, may also help reduce anxiety. So A.R.C II is really good for the type of adrenal fatigue, which causes you to be really jittery. So a lot of people, when they lay down in bed, they have really low energy all throughout the day, but they lay down in bed and they can't turn their brain off. Okay, their brain is really high, it's high pace, it's just going constantly, and they have a hard time dropping that down. So that's sort of like this anxiety-filled adrenal fatigue. Now, the ingredients in A.R.C are specifically designed for that type of adrenal fatigue, but they will help all types. Okay, so remember, there's a lot of crossover here, especially when we're talking about adrenal supplements, but A.R.C can potentially help both. Okay, so let's talk about what makes it so effective. So it has about 5 or 6 ingredients. I don't remember exactly off the top of my head, but the main one in it is ashwagandha, and it comes in a formulation called Sensoril. Now, what Sensoril is it's a combination or formulation of ashwagandha, which has a really high percentage of withanolides. And withanolides are the active ingredient found within ashwagandha. So what we've done is we've just increased that concentration, so you need a lower dose. So previously, if you wanted to use other types of ashwagandha, you need a fairly high dose to get the benefits you were looking for, the benefits I just listed previously. But if you use Sensoril, you need a lower dose. So that's kind of how that works. It also has relora extract, L-theanine, banaba, and then of course morale extract. And the idea here is to help balance neurotransmitters, help balance cortisol levels, help balance other hormone imbalances, and so on. So that's really what all of these ingredients are doing. So let's talk a little bit about whether or not you should use it, right? So as I said before, if you have thyroid problems, then you probably would be better off using thyroid adrenal reset complex. So again, that's another product that I have, another video, you can check that one out. So who would want to use A.R.C II? Well, as I said before, this one, hopefully you can see that here, I don't know if you can, but hopefully the difference is this is a vegan supplement, whereas thyroid adrenal reset complex does have some animal products in it. So if you're looking for an adrenal/thyroid supplement that is animal free, this is the one that you're going to want to look at. Also, if you have those high levels of anxiety, the adrenal fatigue that also causes low energy levels, but inability to shut down that brain, and you're suffering from that anxiety, that's the situation that you'd want to use A.R.C. Now, I personally would recommend that all people should consider using an adrenal supplement. I don't have thyroid problems. I have other issues. I have some autoimmune diseases and so on personally. But I take an adrenal supplement every day. That's because just what life does to us, right? Like a lot of us aren't getting enough sleep. A lot of us are being overworked and overstressed, and we put that upon us, sometimes intentionally and sometimes unintentionally. We don't always have control over that. But so many people fall into this situation. So my general recommendation when I treat people is to put them on an adrenal supplement. That's why my number 1 and 2 bestsellers are these, because I just believe in that. That's what I recommend. But there are other people who would benefit from it as well. So especially people who have thyroid problems, which is, I focus a lot on thyroid problems. And those people who have thyroid problems, anytime you have a low or sluggish thyroid, you're always going to drag down your adrenals in the process. So I have never met a thyroid patient who didn't also have adrenal problems. Okay, it's just how it works. Unless, of course, they're perfectly optimized, which does happen, but it's very, very, very rare. So you can kind of, generally you're probably not going to fall into that camp, which is why these are so beneficial. In addition, if you have any sort of adrenal fatigue problems, or if you know that you do or suspect that you do, then this would be a supplement to use. You do not have to test your cortisol prior to using it. Okay, don't fall into that trap. You don't necessarily need to do that because cortisol is often very inaccurate. It's not even necessarily a good reflection of what's going on in your body because you can check it through your saliva or your urine or your bloodstream, and they differ in all different areas. So you don't have to necessarily worry about ordering cortisol. If you have it, great, but you don't necessarily have to. Another benefit of using this is that the ingredients in it help balance cortisol. So if they're high, it brings them down. If they're low, it brings them up. That's sort of how it works. So it's really good in that regard. So the way to use it is real simple. It's 2 capsules per day. They can be taken with food or without. You don't need to worry about that. And it can be taken with all types of thyroid medications as well. Obviously, you don't want to take them at the same time. You just separate it by 30 to 60 minutes. But that's the story there. It can also and should potentially be used with adrenal glandulars. So this supplement has only adrenal adaptogens. Okay, so that's an herbal ingredient. Remember, no animal products in this in A.R.C II. But in certain individuals, especially those who have a low cortisol level, or they have really, really severe fatigue, especially with thyroid problems and so on, they have all these things together, they might benefit from using both A.R.C II and then thyroid adrenal reset complex, which has the adrenal glandulars inside of it. So a common combination that people will use is A.R.C II plus thyroid adrenal reset complex, and I would recommend that if you have really severe adrenal problems. We have a lot of people who just take this though, so you can do that also, but if you want to step it up a notch, that's what you want to consider. So if you have questions about A.R.C II, leave them in the comments below, or simply reach out to us. We're happy to answer those questions for you. We'll let you know if we think it's right for you, okay? If we don't think it is, we'll let you know, or we'll just say, hey, you might want to try this instead. It kind of depends on your situation. So if you're confused, don't be. Just reach out to us. We'll help you out with that. By the way, of course, all of our supplements are organic, produced in a GMP compliant facility, third-party tested and verified. They represent, and they're NSF sports certified, TGA certified, etc. We go through the highest standards that you can in terms of the U.S. Supplements and the quality. So don't worry about anything like that. But if you have any questions, reach out to us, and we're happy to answer those for you. And otherwise, I'll see you guys in the next one.